What a tremendous afternoon, and it's a real honor to be the last person to speak to you today. Thank you to Upstream and to Ryan Miley for inviting me. And I want to acknowledge, before I begin talking about income as a determinant of health, how many of the mentors and people who have taught me about this are in the room today. So I stand on the shoulders of many of the giants in this room. We've just listened to a tremendous synopsis of what it is that income can't do to heal the world and to improve the health of the Canadian population. But I'd like to spend a little bit of time talking about what income can do or could do to improve health outcomes and health equity for all. I think we all know the data that income determines health far more than anything that most of us do in our day-to-day, those of us who work in healthcare, in the one-on-ones, in our offices and hospitals, far more than anything that I could ever do as a hospital administrator, making decisions about programming and budgets. Across the board, and this comes as much from the work of Sir Michael Marmot as anyone else, across the board there is a very significant income gradient across pretty much every health outcome that you can name. Whether we're talking about the big dot indicators like infant mortality and life expectancy, whether we're talking about amenable deaths within healthcare systems, whether we're talking about outcomes at the intersection of health and the economy, such as healthcare spending and per capita health costs. Every single health indicator that you can pretty much name exists along an income gradient. So while we know that income is not the sole determinant of health, as we've just heard from Armin, and as you can see on the list of determinants of health on the screen behind me, so that we also know that eliminating poverty or income deficiency or income inequality wouldn't fix everything in terms of the health of Canadians, income is the determinant of determinants of health. Now, I'd like to pause by saying that I think anyone who works in the health and social services sector, no matter what your job is, knows that the way that we separate out the social determinants of health, while it's intellectually interesting, really is only intellectually interesting, because in the real world, the social determinants of health pile on top of the same people and interact and intermingle with each other in really important ways. So that poverty leads to poor school readiness, leads to lower educational attainment, which limits people's job prospects, which are further narrowed by racism, which leads to stress and chronic illness, which makes it hard to keep a full-time job, which leads to more poverty. So that actually all of those social determinants of health interplay with one another in a nasty soup that keeps some people at the bottom of the health gradient. So it seems to me that of all the goals that we might want to pursue to improve the health of individuals and communities, ensuring that everyone has an income sufficient to meet basic needs should be right at the top of the list. And let me put it another way, just to be clear. Putting an end to income poverty won't solve all the problems. It won't create more childcare spaces. It won't build us more affordable housing. It won't eliminate racism, and it won't make our water clean. But unless we address income poverty, it's hard to imagine that we could ever close the health gap that so many other eloquent and brilliant speakers have spoken about today. So, how are we going to do it? There are a number of policy options available to us. I'm obviously here to advocate for one. Of course, we could make our existing income support programs in Canada more generous. We could do that by broadening our criteria for inclusion. We could do it by changing the magnitude of benefits. And actually, we heard earlier from Valerie how even just doing that in the province of Newfoundland can have a very significant impact. So we shouldn't, poo-poo the notion that we can make existing social assistance programs more effective in the services that we deliver and the supports that we deliver to people. So that's an option. A second option is that we could, as we've just heard, increase the availability of universal programs or even targeted programs, non-monetary benefits for low-income people, whether it's subsidized housing, daycare, pharmacare, et cetera. And of course, I would love to see all of those things. But another option, and it seems to almost be the idée du jour, if you will, it's not a new idea, is the concept of the guaranteed annual income or basic income. And that's what I'd like to discuss in a little bit more depth in the rest of my remarks. This is effectively an income top-up for people whose incomes fall below a level sufficient to meet basic needs. So what's the concept of the basic income and how does it work? There are effectively two different designs, and actually I'm just going to pause for a second here to clarify. There are as many different meanings or designs of a guaranteed annual or basic income as there are people who advocate for it. Okay, so some people, when they talk about basic income or the basic income guarantee or the demo grant, are effectively talking about a cash transfer to all citizens or to all residents of a community or a country, okay? And in that instance, and this is a live debate, and in fact, in many developed countries in the world, in the Dutch city of Utrecht, in Finland, and other places, there is active work happening in order to try to implement this version, the so-called universal demo grant. And this is, there have been large-scale pilot studies done in the developing world as well. For those who are interested in learning more about this particular model, I would recommend the work of Guy Standing, who's written extensively on these pilot projects. The Brazilian Bolsa Familia, there are lots and lots of examples of this where effectively what you're doing is giving a cash transfer and you're giving it to virtually everyone, and then high-income people pay most of it back in taxes. And of course, you can imagine that there would be benefits to that, not the least of which the kind of solidarity that Armin was just talking about. Anything that is universal, effectively, is a very effective way of sort of getting the buy-in of the middle and upper class. That is not the idea that I hear being seriously talked about in Canadian policy circles. It's also not the version that I personally support, although I'm happy to have it out in the Q&A with people who see this issue otherwise. The idea that is most often talked about when we talk about basic income in Canada is the so-called guaranteed annual income. Some people refer to it as a negative income tax, and it effectively works like this. If you earn less money than a cutoff that we collectively decide upon, whether it's the LICO, the low-income cutoff, or some other measure of poverty, or a level at which we determine that no human should fall below, we top you up. How do we know that you fall below that level? We know because of your income tax submissions. And so it's a quite straightforward and relatively simple system to administer. There are layers of complexity underneath it, but that's effectively what we're talking about. And one of the beautiful things that advocates of the basic income talk about a lot, and it's certainly something that I can relate to, listening to Dan Raza's terrific talk about the work that's being done at St. Mike's, or thinking about the work that gets done in community health centers for people living in poverty, the administrative burden of being poor is stifling. So when we think about a system that would allow us to move away from the invasive nature of these programs that require you to meet, dozens and sometimes hundreds of criteria to fill out forms, caseworkers going to people's homes, having to prove that you're looking for work but you're not getting any work, whether or not you have a spouse in the house, whether you dared to go back to school, any of these things in the fundamental concept of the basic income guarantee, all of that is taken away. There is one criterion, and that criterion is, does your income fall below the level that we have deemed to be essential for meeting basic needs? And if it does, you get topped up. You also don't have to sell every asset, cash in every single RSP and drive your entire family into destitution in order to qualify for the receipt of benefits. And that's something that I think those of us who've seen people fall on hard times and be ineligible for social assistance programs because they did have a job and they did pay into some RSPs when they were employed can appreciate what a difference that would make. So how does it work? You get your money when you fall below the basic level. Of course, it would have to vary depending on household size. The way that people most often talk about this in the literature, if you think about it, is essentially every human is entitled to a basic income. So if you happen to be two adults cohabitating, then that amount is going to increase. If there happen to be children in the house, that amount is going to increase. People have, and I'm going to get to this in a little bit when I talk about the Manitoba experiment, the ways in which you attribute that income to each individual in the household also gets away from some of the ways in which the definition of household size can be punitive to people. And if you go to work, you don't lose everything. And this is a really important point with respect to guaranteed annual income design, where it parts company philosophically from social assistance. We're living, as we all know, in an increasingly precarious economy, more and more people going in and out of the job market, more and more people working on contract, more and more people working part-time. People fall sick, they reduce their hours, they have their hours reduced, they're laid off, they come back as temporary part-time contract workers. I'm not endorsing that version of the labor market, but one of the things that happens under a basic income is you don't fall below that level of income just because you've gone back to work or your hours of work are fluctuating. And I think that that's a really important component of the design. I'm just going to pause to say that I think it's important that we, in the interest of academic rigor, ask ourselves the question, we know that income is an important determinant of health. What is the evidence that giving people income in this manner actually improves health? Because we can't assume that it's sort of tautologically true in both directions. And in fact, this is an empiric question, one that we do have some evidence on, but I think one that we could collect further evidence on. How would we answer the question, how do you know if giving people money actually improves their health? Well, we actually have evidence to look to here in Canada, and you've already heard some of it from Valerie earlier with respect to old age security and the guaranteed income supplement for seniors. So actually, we have two populations of people in Canada who effectively already receive a guaranteed annual income. Everyone over the age of 65 and families with kids through the Canada Child Benefit, formerly known as the Canada Child Tax Benefit. So these are effectively guaranteed annual income programs that exist in our country. And what we have seen, and you've heard some of that evidence already, is that literally the day that people turn 65, their risk of poverty declines, their risk of, of course, their general risk of getting sick increases with age, as all of ours does, but their relative risk and certainly their food precarity and other measures decline substantially under GIS and OAS. And for children, similarly, tremendous research that's been done by Mark Stabley at the University of Toronto and others looking at how families spend that money. And I'm sure you'll all be pleased to know that parents who receive the Canada Child Benefit for their kids don't spend it on beer and cigarettes. They spend it on textbooks for their children. They spend it on transportation. They spend it on food. They spend it on rent. But of course, the example that everyone always turns to when we talk about the guaranteed annual income is the famous example that was, the famous experiment that was done in Canada and Manitoba in the 1970s, the famous Mincome experiment. Some people call it the Dauphin experiment because it was actually also done in Winnipeg, but it was also done in a small farming community called Dauphin, Manitoba. So what did we learn from Mincome? Mincome was a simple program. It was designed pretty much as I've just described to you. Everybody in this entire farming community had access to a guaranteed annual income. If their income fell below a certain level, they were topped up. And to keep a long story short, as evidenced by the research of Professor Evelyn Forget from the University of Manitoba, as a result of that project, we saw an 8.5% decrease in hospitalizations. Kids stayed in school longer. There were fewer visits, outpatient visits, particularly around issues relating to mental health in the healthcare system. People had children later, and they had fewer children. If we had discovered a drug that reduced hospitalizations by 8.5%, we would be putting it in the water, right? So I think it's important to understand that we actually do have good empiric evidence that improving people's incomes improves their health. Furthermore, there's the human impact, and Evelyn Forget's research team went back to Dauphin and talked to some of the elders living in that community who remembered the days of Mincome and had participated in the study. And when they talked to people, the biggest thing that they heard about was the absence of stigma. and what it felt like to be in a community where there was no shame involved in having your income topped up, because everybody knew that it could happen to you at any moment. I'll just say as an aside that I fell into the guaranteed annual income because it appealed to me for the same reasons that I have always believed in universal public health insurance. It's the same basic principle as Medicare, right? We all pay in, we all hope we're not gonna have to use it, but if someday you fall on hard times, you know that you won't be bankrupted by your illness or by the illness of a family member, and the principle of the guaranteed annual income, and I think the values that underpin it are quite the same. So, we have a million questions. What should the cutoff be? How would you design it? At what rate would you tax back people's income who are receiving the benefit? What might the unintended consequences be? How would you mitigate those consequences? There are hot debates. And of course, given that the MINCOME experiment was 40 years ago, it seems to me that some modern day pilots are called for. I wouldn't personally dive right in and overhaul the entirety of our social assistance infrastructure just yet, but I think this is an idea that holds tremendous promise. And it holds promise not only because it looks upstream at the factors that actually affect whether or not our communities are going to be healthy or sick, but because I actually do believe that it builds on that principle of social solidarity in a way that's extremely appealing to Canadians. The good news is we can get started now, because as of last month, there was an announcement in the Ontario budget that there will be a pilot project in the province of Ontario. And so all of these very important design questions about how to do it right are no longer theoretical. They are applied questions that we can dive into as part of what I think is one of the most exciting social experiments of our time, perhaps with the exception of the at-home chez soi program that you've already heard a little bit about. So in closing, I'd just like to say that I think there's no need for us to, there's healthy debate about what the right way is to have a real impact on the upstream social determinants of health. Would that we were in a position to choose between massive expansion of social housing and daycare spots and a basic income for all. I would love to have that, that hot debate, knowing that we could press a button at the end, vote, and actually implement it across the nation. But the fact that we're having these conversations is incredibly important, and the fact that you've all stayed to the end is extremely heartening. Thank you.